Oh.
Welcome to ProMed's DVD on how to properly draw blood using the venipuncture technique. Here, as you can see, I have all of the supplies that you would need to get started. First, you have your what we call our biohazard container here, which is your sharps container, which is used for all of your sharps. This is your puncture-proof container. You have your red bio bag here where you would put all of your blood contaminant or anything that actually has touched the patient's skin. Even your own gloves will go inside of this here. There, you also see hand sanitizer. This is very important to us. This is what we're going to use to actually sanitize our hands. Then, of course, you have your tubes and their holders. You have your Coban or your Coflex wrap, which will be used as a bandage. You have your gauze. Your gauze would actually be used to apply pressure. You have your 70% alcohol prep pad, which would actually be used to prep the skin. Then, of course, we have our vac container holder, your vac container needle with your safety device. You have your latex tourniquet, and then, of course, I have my gloves here. So I'm getting ready to start the actual procedure itself. The first thing that you want to do is you want to make sure that your hands have been sanitized. So you want to go ahead on and you want to sanitize your hands, or you can wash your hands. But I do not want you to substitute sanitizing your hands for hand washing. Remember, after so many sports of the actual Germ-X itself, you're no longer protected. So you need to continue to wash your hands. So you're still going to wash your hands in between patients. The next thing I'm going to do is actually I'm going to place my gloves on. So you're going to go ahead on, place your gloves. Make sure your gloves are not too tight and they're not too big. If the gloves are too big, you'll possibly stick yourself, okay? And if they're too tight, then you'll possibly break the gloves and then it will make you expose yourself to the patient's blood itself, and you don't want to do that. So the first thing we'll do, after we place our gloves on, is we're getting ready to tie our tourniquet. Remember, your tourniquet is tied 3 to 4 inches above the elbow, okay? So 3 to 4 inches above the elbow is where we're going to actually tie the tourniquet. So once I've tied the tourniquet, I'm going to use my index finger to feel for the veins, okay? Remember, your veins are going to be spongy. They're going to be soft. They're going to be flexible. You can actually press them down. They'll bounce back at you. You can roll over them. So you're going to trace along the pathway of the vein. Remember, center is mediocubital, right? Basilic, which is the vein that you want to avoid at all times, is going to be located outer. And then the cephalic, which is your second vein of choice, will be located on the actual outer end. So again, mediocubital is center. Inner is going to be cephalic, which is the vein you should avoid. Outer is actually going to be what we call the cephalic. Okay? So once you determine where you're getting ready to stick to insert your needle, you're going to release your tourniquet using the short end of the tourniquet. I'm going to go ahead on and attach my vac container holder to my vac container needle. Okay. I'm going to come back. I'm going to re-tie my tourniquet. Okay, this is the last opportunity I get to feel. Alright. I'm going to use my alcohol to clean. I'm going to pull back the skin, this is what we call taunting the skin, so you're actually taunting the skin, and you're anchoring the vein all at the same time, okay? So we're going to clean the entire area with the C-swipe. You're going to come back over in another C-swipe circular motion, clean. You're going to pick up the needle. Make sure you release your cap with one hand, drop it. Then you're going to look at the actual needle, inspect the needle itself. You want to make sure that it's not bent and it's free from any type of fuzz or anything else, okay? Come back, taunt the skin. Okay, you're going to insert the needle at a 15 to 30 degree angle, all right? So you're going to go ahead on and quickly insert the needle. Once you've inserted your needle, you pick up your first tube, which is always your non-additive tube. You place it inside of the arm. Once you get that nice red flow of blood, go ahead on and release the short end of your tourniquet, guys. You're going to go ahead on and twist and pull it, alright? Fit the tube inside the holder. You will pick up your second tube, which my second tube I'm going to use is what we call an EDTA. This is your lavender top tube, which is actually used for CBCs, which are your complete blood. So I'm going to place that tube in. Alright. Once my tube is full, and remember, you need to fill your EDT tubes about two-thirds, should be about two-thirds full. You want to go ahead and invert. Okay, so invert your tube. You're going to pick up your gauze. Place your gauze above the area. Pull out quickly. Apply pressure. Okay. Now you're getting ready to place your safety device over your needle. Okay. And what we're going to do is we're going to go ahead on and we're going to dispose of the needle inside of what we call our puncture-proof sharp container. Okay. So here we're going to apply pressure to the patient and we're going to elevate. Okay. So we're applying pressure and we are elevating. Everything that we actually use for the patient is going to go inside of what we call the red bag. So all of that goes inside the red bag. For bandage, we're going to use what we call the Coban wrap, which is a self-adhesive wrap, you guys, so it should be really easy to place it on. Place the bandage there, alright, and then you're done. So now you have it, okay? The steps are very simple, you guys. First thing that you want to do is you want to always tie the tourniquet once. Then after you tie the tourniquet once, you want to palpate the arm, determining what vein you're getting ready to use. Once you determine the vein you're getting ready to use, you want to release your tourniquet, always using the short end. Once you release your tourniquet, then of course you want to make sure that you have your needle and your vacuum container assembled. You have the tube according to your laboratory requisition form. You want to make sure that you have your gauze, your alcohol pad, and whatever type of bandage that you're going to be using, and of course your gloves. You're going to go back, you're going to retie. Once you retie the tourniquet, then you're going to use your alcohol pad, which is 70% alcohol, to C-swipe. C-swipe using a circular motion. So you're actually cleaning the entire area. Once you C-swipe in circular motion the entire area, then you're going to get your nice, clean, sterile gauze, and you're going to go back over the alcohol, cleaning away the alcohol. Remember, you guys, the alcohol will burn if the arm is still wet when you try to insert the needle. Next thing you're going to do is you're going to insert your needle at a 15 to 30 degree angle. Once you've inserted the needle into a 15 to 30 degree angle, then you're going to place in your first drawing tube. Remember, always follow the proper order of draw when you're drawing. Rule of thumb, you guys, please remember non-additive tubes, which are your red top tubes, over any of the additive tubes. So after you draw your tubes according to your requisition form and according to the order of draw, then what you're going to do is you're going to pull out your needle. Once you've pulled out your needle, then you will apply pressure, and once you've applied pressure, you will have your patient to elevate their arms. Once the arm has been elevated and applied pressure, then you will place the bandage, and there you have it. A successful blood draw has been done. Thank you for watching this DVD on how to properly draw blood using the venipuncture technique.